Shifa Hospital is Gaza's largest hospital complex and is a compound made out of multiple buildings with grounds. And it is now completely filled with thousands of families who have flocked because they feel it's the safest place to be. And so when you walk from one building to another, there are families around the grounds, on mattresses, on carpets on the floor, seeking refuge. The hospital itself, which has a bed capacity of between 670 and 700 beds, is at capacity. And the patients keep coming in. And at the moment, it's so overwhelmed that we, as plastic and reconstructive surgeons, already have 50 patients waiting to go to the operating rooms. But the most critically ill are taking precedent because of the limited space. And this tsunami of wounded, 4,500 wounded in 4 days. And all of these are severe wounds. And even the ones that are limb wounds, that are not life-threatening but limb-threatening, require long and repeated surgery.
And you must also have a problem with supplies now.
We are at, in year 15 of the siege on Gaza. This has left the Palestinian health system on its knees. And so when this war started, the situation was quite crippled as it is, with all of these wounded, with this complete siege that the Israelis have imposed. My estimate is that the system will collapse within a week, if not less, unless there's a humanitarian corridor and aid is allowed in. We are running short on basic supplies already.
We are seeing some pictures from outside the hospital. People may find them distressing, of course, the dead and, as you said, those who've been injured by blast injuries. Particularly, you said you were operating on this young girl earlier with the facial injuries. I gather that a substantial number of those coming into the hospital are children.
Around 30 to 40% of the wounded are children. And this happens when you target people's home. That's where the children are going to be injured. And these, what makes war injuries in children different is that this is a growing body and will need a lifetime of repeated surgeries if the child survives.
Let alone, I guess, the psychological damage and harm that is done. How safe do you feel there, bearing in mind we have these reports that a ground offensive may be imminent, and clearly the airstrikes continue, although the hospital has not been hit directly, of course?
The area around the hospital has been continuously targeted. Every few minutes, the buildings shake from the sound of blasts. I'm sleeping in a colleague's office on the couch because it's just not safe to leave the hospital and walk around anywhere. The ground offensive is going to lead to absolute carnage, worse than what we are already seeing, and we're bracing ourselves for this. People are extremely anxious and worry that the worst is still to come.
Dr. Ghassan, what are your thoughts when, for example, we were talking to a human rights lawyer earlier who talked about the massacre that has taken place in Israel, the mothers, babies that have been killed in that raid on the kibbutz. They say, we're going into Gaza, this is all Hamas's fault. Civilians dying is Hamas's fault, or will be Hamas's fault.
If you recall, in 1982, the Israelis invaded Lebanon, killed 30,000, besieged Beirut for 88 days, and then allowed their allies to go into the Palestinian camps of Sabra and Shatila and massacre 3,500. And the discourse at that time was also that we're not going to target the civilians, we're just going after the PLO. And a generation later, we are hearing the same story. My patients have, this 6-year-old girl that lost half her face and her mother is dead, has no say in what's happening. And we've had patients who have been injured for the second time. There are kids in Gaza who have now been injured, who had been injured in previous wars in Gaza. 15 years, more than 6 wars on Gaza. This generation that has known nothing other than the siege and repeated attack, to the point where they're getting re-injured in multiple wars. That's what we would... everything that has happened in the last week shows that the siege on Gaza should not be allowed to continue, and that the Palestinian question has to be solved, that the rights of Palestinians for self-determination. This is not an issue that can be put on the back burner again, which is what has been happening for the last over a decade.
And just to be clear, of course, this is what the Israelis say as well, and say they have to go after Hamas this time. But to talk about the days to come, what could and what should happen in terms of trying to get perhaps the injured out to a safe corridor, or indeed making that hospital where you are a safe zone?
We need a humanitarian corridor for the wounded to be evacuated and for aid to come in. International aid agencies, humanitarian organizations have been prevented from sending in teams into Gaza. These teams need to be allowed in. And hospitals and health facilities need to be given sanctuary. Yeah. So that people can access healthcare.
And what do you need? Is it the basics of plasma and wound dressings and antibiotics and all those things that you would take for granted in a modern hospital?
All the consumables that are related to the treatment of these massive injuries, from dressings to antibiotics to antiseptic solutions to medication to anesthetic medication, all of this is running very short. And unless it's replenished, we're going to run out. We're already 50 patients behind in terms of access to the operating room. And this is day 4.
Dr. Ghassan, can I just ask how you are? You only went out earlier this week. You went to stay with your uncle, I think it was, but you were evacuated due to bombings. Where are you living? How is your family?
So I've moved into the hospital and I'm staying on the couch of in a colleague's office, because you can't move outside the hospital. My cousins who I'd stayed with once we got evacuated have also had to evacuate their house themselves. And everybody that you see around you and speak to have similar stories. One of my young surgical colleagues in the plastic surgery department, his house was destroyed. He's had to move his wife and kids to her parents. Another one of them, his brother-in-law, was killed this morning when their house was targeted. When you're operating all the time between cases, everybody's on their phone trying to find out where their families are. So, my colleagues within the health system here are part of the same communities that are being targeted. And their worry is always about where their families are and if they're safe or not.
What is your view and your family's view of what Hamas have done and Hamas? The suggestion is that the 2 million Palestinians there are as much being held as hostage by Hamas as the 130 reported Israelis.
This is a 75-year-old war on the Palestinian people. To randomly pick a point and say this is when the violence started. Over the last 2 years, we have witnessed pogroms against Palestinian villages and towns in the West Bank by Israeli settlers. Over 50 Palestinian children were killed by the Israeli army while demonstrating and posing no threat to the Israeli forces. The siege itself, 15 years, a whole generation, is a form of violence. Palestinians have gone through one generation after another while having their basic rights denied. to pick a point, a random point, and say this is when the violence started because that's when it showed up on our TV.
But can you understand that the Israelis have actually said that this is the point where they do have to do something against Hamas, bearing in mind what happened in the kibbutz, where families were shot and murdered in their own beds, with the reports of young children and babies being killed and even beheadings, although that's not been confirmed independently?
But in '82, they said the same thing about having to wipe out the PLO, and it fails to address the issue, which is justice for the Palestinian people. That, you know, the fact that in the 21st century, we still have settler colonialism and the Palestinians are being denied their basic rights is the issue. It's not finding another political foe to try to pin this and reduce the whole struggle on the fact that either Israel was after the PLO in the 80s or Israel is after Hamas now. Israel has been after the Palestinian people since 1948. The logic of elimination, which has managed or has been the hallmark of the relationship between the Palestinian natives of this land and Israeli settlers. This logic of elimination has seen Palestinians attacked over 75 years, have seen Palestinian lands confiscated, and have seen Palestinians being killed and imprisoned. That's the issue. This cannot continue.
Yeah, that is the political aspect, of course, where the Israelis would have a different narrative, but you've shared your views, and of course you've updated us on your life-saving work there in the hospital. We wish you and your medical staff all the best in terms of putting those children back together again, literally, which is what you're having to do in those operating theatres. Thank you very much, Dr. Ghassan Abu-Sittah, there in the hospital. Thank you.